Hi everyone, this is Dr. David Lee at Physical Therapy and Balance Center Germantown. In this video, I wanted to share with you all an exciting modality that we have in the office, and it's a class 4 laser. The laser is just a term that we use, but it's really infrared light. And so this is light therapy. Many people know that UV light from the sunlight, helps us produce vitamin D in our body. So we know the effects of UV light. Less known is what happens when our body gets introduced to infrared light. So in the light spectrum, there's violet and red, and there's many in between, about 7 different lights. The ultraviolet light comes from the sun. This machine is going to produce infrared light. Many of you come in because you have pain. Pain is probably the first symptom that you experience that causes you to either go to your doctor or directly come in to see us. And so a lot of times we got to get you out of pain so that we can start strengthening, or we can start working on your mobility and improve your function. So getting out of pain is the first step, and a lot of times that takes up a lot of our visits. So when we start using laser therapy, we can get you out of pain much faster so that we can get to the meat and potatoes of our therapy, which is working on mobility, strength, and function. And so this is a great modality to have, and we're really excited to have it here in our office. This machine can produce up to 15 watts. For a much more powerful laser, we can get the appropriate therapeutic effect because we can get more dosing or more light or energy into the tissue. Many of you will want to know the science behind it. This video isn't intended to go into the deep sciences of it. If you would like, Google photobiomodulation, and there's tons of literature there that if you want to research, you can do so. But I wanted to talk to you more of the application, how we use it, what it does for us. Recently we had a patient who had neck pain that shot down the arm. We call that cervical radiculopathy, where a neck nerve root is irritated or hurting and it shoots down the arm. And a lot of times that's very painful. We could barely get her to extend the neck, and we used light therapy. In about 4 visits, we got her radicular pain, which is the shooting pain from the neck, to go back up to the neck. So meaning the pain in the arm went away, we got it isolated to the neck, and we were able to start working on the neck primarily, and then get into strengthening. And she's done great since. And she was a candidate for surgery, and so we were able to avoid that with her. So these are some of the stories that we are able to share with you. We've seen tremendous improvements in people's pain symptoms, so that we can get you to start moving and exercising and improving your functional goals. Okay, so I wanted to demonstrate with you just how we apply it. So the machine is pretty sophisticated. It has a computer that I can just put in the parameters, and it kicks out the time that we need, and all I have to do is just move the wand onto the patient. There's 2 attachments that we use primarily. One is this applicator tip here. We call this a massage ball, and we can put that directly to the patient's skin. If it's a bony area, an area that doesn't really do well with contact, we'll use a cone. So we'll put this cone on, and it creates a direct beam, and we can just move it. So we call this contactless. We call this with contact. So we're going to put this directly on you, or this will be hovering over the body part that hurts. What I need to do is basically find out how much of an area I want to treat, okay? And so I'm going to put that down. And again, this machine can go up to 15 watts, which is really strong, which is the most powerful laser that's out there. That's what makes it a class 4. So I'm going to put 15 watts, and then the next step is to put the amount of joules I want, okay? And again, for the purposes of this video, I don't want to get into the deep sciences of it, but we know how to set the parameters so that we can dose the tissue appropriately with the amount of energy that we want. So I'm going to use for this one a massage ball contact, and for safety, because this is a light, we're going to wear glasses, okay, and the patient has one as well. Danielle has a glass on as well. And so I'm going to start the machine, and it's warming up right now. Okay, and once the laser is ready, you're going to see a red light here. I'm going to touch this switch button, and then now I'm applying. The beeping that you hear is letting me know that there's laser being emitted through the wand, through the applicator. And I'm just going to move it back and forth slowly over the elbow. So here, this is a great application for those of you who have tennis elbow or tendonitis in the forearm. A lot of you may be typing a lot at home using a mouse, so this can be a treatment of choice for that. But again, we're trying to create pain relief so that we can exercise the tendons. So one of the things we do, we try to visualize the muscle and the tendons, and I'm trying to just paint over or touch every part of that tendon. You will start to feel a little bit of heat with it as well, which is soothing and helpful. So the machine will tell me, or time for me, how long I need to get the appropriate amount of light or energy into the patient's tissue. The benefits of it is that we can get you out of pain quicker. And if we can do that, we can get to the mobility, the strength, and the function part, and get back to what you enjoy doing, get you back to everyday activities and life. I hope this is helpful. For those of you who want to dive a little bit more into the science, by all means, please do that. I'll be happy to talk with you more about the science of it, but the application is what I really wanted to discuss today in this video and talk about how this can help and how we use it. That was helpful, and we'll talk to you in the next one.